love the chase and the hunt, and I set the pace when I'm running. I always take what I want and I always give it 100. Don't need a bank, no I'm funded. Play the game like it's nothing. I'm always thankful for something. Don't take for granted, stay humble. Now wake up! It's time to look at the enemy. Look in the mirror if he is no friend to me. It's not working out, maybe it's the chemistry. It's time to break up so I can make a better me. Better believe in your mind, cause it's everything. You can mold, shape, find almost anything. All it takes is some time and some clarity to find your identity. It's mind over everything. I'm immortal. When I feel like this, I'm immortal. When I feel like this, I'm immortal. When I feel like this, I'm immortal. Don't back. I won't stop, I'ma fight until there's nothing left. It's so on, you're gonna be hurting bad, cause I've been to hell and back. You don't wanna make me mad, I stay strong, you will never see me crack. And if you get in my way, you're gonna feel the wrath. Gotta say
hello, all you beautiful people. Good to see y'all. I hope y'all are doing well on this hump day. Thank you guys so much for being in here. Please hit the like if y'all haven't done so. All right. I see 2 people in chat. Hello, Ryan. Good to see you. It's been a while. Hope you're doing well. Let's see. Hello, Miss Julie. Good to see you, sweetheart. I hope you're doing good, honey. All right. So this is one of our mental health lives. It says benefits of counseling or therapy, mental health. Tonight we're going to be talking about the benefits of counseling or therapy. Does it work? What good is it for you and your mental health and well-being? Panel to discuss. We don't have to have a panel, but if anybody wants to come up and discuss anything, you just let me know and I will put the link in there. I'm not going to put the link if nobody don't want to come up, which is fine. You don't have to. Hello, Mama Digger. Good to see you, love. I hope you're well, sweetheart. And I hope Ghost is doing good. Tell him we miss him. All righty. So let's see. All right, guys. Look at my new pretty live background. I love it. Love, love, love it. Tell me what y'all think. Can y'all see it okay? All right. Or this one. I figured, Mama Digger. I figured, honey. Yes. So we're going, and this ain't going to be a massive long live, guys. I just thought, because a lot of people talk about counseling and therapy. I just thought, we would talk about it a little bit, and then we would, let's see, sorry. We would close out for the night. All right, so let me fix this back to where it was. Okay, guys, all right, so let me present the screen. Okay, can y'all see that? Okay, can y'all see that okay? Okay, I thought it would be a little bit better so everybody could see it. I'm doing it this way. What are the different types and benefits of therapy? Says talk therapy or psychotherapy takes place when you work with a mental health provider to improve your mental health. There are many benefits of therapy, such as learning specific skills or Lord have mercy, I can't even talk. Coping strategies. This article will discuss the different types of therapy, the benefits, who should go to therapy, and some tips for finding the right therapist for you. Benefits of therapy. Mental health therapy is helpful for about 75% of people after 6 months of therapy. People with mental health conditions who go to therapy often see improvements in their symptoms and quality of life. From 2018 to 2019, about 19% of American adults received some form of mental health therapy or counseling, according to the data from the Center for Disease Control and Prevention, or CDC. It says, that said, the benefits of therapy are not limited to people with diagnosed mental health conditions. Anyone who needs guidance or listening ear during a stressful life event can benefit from going to therapy. Therapy can help you get through a challenging life event or situation, address symptoms like excessive sadness, guilt, or anger, treat a mental health condition like depression, navigate relationships with others such as family, friends, and coworkers. The potential benefits of therapy include improvements in communication skills, sleep, happiness and life satisfaction, empowerment, mental function, productivity, number of days attending school or work, relationships and interactions with other people. Physical well-being, like lower blood pressure and less chronic pain, skills for coping with daily life challenges and stress, management of behavior health goals like quitting smoking or drinking alcohol. Types of mental health therapy. Mental health therapy can be done in a variety of settings. Individual therapy is for one person and a mental health professional, while couples therapy is for intimate partners and a mental health professional. The benefits of therapy extend beyond those in treatment. For example, one person can go to individual therapy, but the other people in their life will likely benefit from that person's improved communication and relationship interactions. Another example would be a person who misses fewer days at work because working with a therapist has helped them manage their symptoms more effectively. That person's coworkers will probably benefit from having them at work more consistently. Therapy versus counseling. Therapy and counseling are often confused, and the terms are sometimes used interchangeably. However, therapy and counseling are different. Therapy focuses on mental health conditions or behaviors, thoughts, or emotional patterns. It usually takes place over a longer period of time, and a person may work on several goals related to their mental well-being. Counseling It's focused on specific issues that a person is dealing with, such trouble getting along with a partner or a family member. It can be more of a short-term opportunity to work through these challenges as they are happening. Individual therapy. Individual therapy is talk therapy between one person and a mental health professional. This setup allows the treatment to be customized to a person's needs. For example, a person who is trying to understand how their childhood influenced who they have grown up to be may benefit from working one-on-one with a therapist. This type of therapy is sometimes called dyadic therapy or individual psychotherapy. There are various types of individual therapy, including cognitive behavior therapy, CBT, dialectical behavior therapy, DBT, which also has a skill training group component, psychodynamic therapy, eye movement desensitization and reprocessing, or EMDR, humanistic therapy, and mindfulness therapy. Family therapy. Family therapy is talk therapy that involves a mental health professional and the whole family, each family member individually or sometimes groups of family members. For example, if a family is having trouble communicating and often fights, yes, I can. When I'm just bringing awareness to it. So no, I'm not a licensed professional or anything like that, but yes, I can bring awareness to it. No, I'm not. For example, if a family is having trouble communicating and often fights, a mental health professional may meet with the entire family at the same time, then with each parent, a child individually, and then with one parent, a child or two siblings, to identify challenges and barriers to communication. From there, everyone can work on making changes that will help them communicate more effectively. This type of therapy focuses on family relationship and patterns and behavior within members. It is sometimes called marriage and family therapy or couples and family therapy. Hold on just a second, guys. Make sure that troll that come in here, I'm able to bring awareness to whatever I see fit. So I can talk about it. Couples therapy. Couples therapy is talk therapy with a mental health professional and two partners in a committed relationship. No, I'm not a scammer. This type of therapy involves both partners receiving therapy together at the same time from the same mental health professional. For example, a couple who is trying to decide whether they are ready to become parents may benefit from working with couples therapists. Each partner can also have sessions within the mental health professional individually. When the couple is married, it's also called marital therapy. The challenges addressed with couples therapy are those that affect both partners as well as their relationship. Topics that can be addressed in couples therapy include communication styles, issues and disagreements, parenting styles and family conflicts, sexual difficulties, behavior habits that are causing problems such as drinking, smoking, gambling, infidelity, or anger management, mental health conditions of one or both partners, life transitions such as unemployment or new employment, moving to a new place, buying a home, having a child, or planning for the future, emotional disconnect within a relationship. Group therapy. Group therapy is talk therapy with at least two people and at least one mental health professional. The people receiving therapy can interact with each other under the guidance and support of a mental health professional. For example, several people who are all recovering from addiction may benefit from having therapy together. In group therapy, everyone gets to share in the therapy experience. It also sometimes calls group psychotherapy. A support group is a type of group therapy where people getting therapy are all facing the same challenge, such as losing a loved one. Hold on just a minute, guys. Who should go to therapy? Different types of therapy are available to help people with many kinds of physical or mental health challenges. Talk therapy is for anyone with mental, emotional, or behavior challenge. However, people without these challenges may benefit from other types of therapy as well. Therapy is also for people looking for support with daily life challenges, going through stressful life events such as the death of a loved one or struggling with relationships. Therapy can help with abuse, trauma, or neglect behavior challenges. Hold on, Tyler. It's in there on chart. Daily life challenges, emotional challenges, life transitions or changes, mental health conditions, relationship challenges, life events that are challenging. Other types of therapy. In addition to talk therapy, many other types of therapy can treat mental health conditions. Talk therapy can be used alone or with another type of therapy. For example, talk therapy is often used with medications or drug therapy to treat mental health conditions. Other types of therapy include drug therapy. Drug therapy uses medications or substances, prescriptions, or over the counter to treat, prevent, diagnose, or improve symptoms of physical or mental health challenges. It can be used along or with other therapies. For example, people with depression might benefit from talk therapy and medications such as antidepressants. Animal therapy. Animal therapy is the use of animals to treat health conditions. It can be effective for both physical and mental health conditions, such as high blood pressure and anxiety. This type of therapy can be used along with talk therapy and other medical treatments. It's also called animal-assisted therapy. Creative therapy. Creative therapy uses therapist-guided artistic activities to help people communicate and express feelings and emotions. It can be used alone or as part of a care plan with other treatments. Creative therapy has been found to be beneficial for improving physical and mental health symptoms such as anxiety, depression, pain, and stress. These types of creative therapy include music, art, dance, or drama therapy. Complementary therapy. Complementary therapy is any physical or mental health treatment that is not part of usual Western medical practice, but is used with conventional medicine. It is only considered complementary therapy when it's used with treatments such as medications when needed. When non-mainstream treatments are used instead of conventional medical treatments, it's called alternative therapy. Types of complementary therapies. Some examples of complementary therapies include diet changes, body treatments like massage and acupuncture, meditation, nutritional supplements, and yoga. How to find a therapist. You can ask your primary care and other healthcare providers for referrals to a therapist. Check with your insurance provider to see who's covered by your plan and use online search tools. It's important to make sure the therapy provider is properly credentialed and qualified to provide mental health care. You should also feel comfortable with and trust the therapist you choose. Telehealth therapy. This is kind of like what I was saying in a previous live. I don't do good on Zoom therapy, but some people might do good on Zoom therapy, but that's what this is. Technology has opened doors for doing therapy in new ways. With telehealth, you can talk to a therapist on your computer, phone, or tablet instead of having to physically go to their office. They started really doing this, guys, when the pandemic hit. With telehealth therapy, you can see and hear your therapist through a secure video chat from the comfort of your own home. Not every mental health care provider can provide telehealth, but many do. If you have insurance, check to see if they will cover telehealth. According to the APA, around 38% of Americans said they used telehealth for mental health or healthcare providers in 2020. Over half, 59% of adults said they consider using telehealth for mental health. Summary: the benefits of therapy can be mental or emotional, physical, behavior, or related to relationships and life. Some common benefits of therapy include reduced pain, better sleep, improved communication, less stress, and increased happiness. There are different options for participating in mental health therapy, including as an individual, couple, family, or group. Therapy options can be used alone or combined with other treatments depending on your needs and goals. All right, that's the first one, guys. And yeah, they were, Julie. You can open up those and see, honey. They said that was a scammer and that I have to be licensed. No, I don't. When I'm just talking about bringing awareness to certain things. No, I don't. All right, guys, let's get this other one pulled up. Psychotherapy. Hello, Demetrius. Good to see you, my friend. Hope you're well. Overview. Psychotherapy is an approach for treating mental health issues by talking with a psychologist, psychiatrist, or another mental health provider. It's also known as talk therapy, counseling, psychotherapy, or simply therapy. I'm okay just dealing with some trolls burning up, and today was the baby's first day of school. During psychotherapy, you learn about your specific issues and how your thoughts, emotions, and behaviors affect your moods. Talk therapy helps you learn how to take control of your life and respond to challenging situations with healthy coping skills. What, Trendy? Oh, Jesus, Trendy. Well, you're down here at the bottom. Trendy says hi. Yeah, they really do.
And I got my hair dyed.
They really do, Julie. Yeah, that's what I said. Each is on it. It doesn't necessarily mean that it's going to help, but it's worth a try. That's what I said. I'm curious if y'all ever done the therapy or counseling, whichever. Let me know what your thoughts are while I'm going over this information. It's not for everybody, but I'm just kind of curious what you guys think. Oh no. Okay. There are many types of psychotherapy. The type that's right for you depends on your situation. Why it's done. Psychotherapy can help treat most mental health issues, including anxiety disorders, such as social anxiety, obsessive compulsive disorder, OCD, phobias, panic disorder, and post-traumatic stress disorder, or PTSD. My doc told me I could get people out of a mental institution. Oh, you had to deal with trolls too? I swear they need to go on. Lord. Mood disorders such as depression or bipolar disorder. Addictions such as alcohol use disorder, drug dependence, or compulsive gambling. Eating disorders such as anorexia or bulimia. Personality disorders such as borderline personality disorder or dependent personality disorder. Schizophrenia or other disorders that cause detachment from reality. Not everyone who benefits from psychotherapy is diagnosed with a mental illness. Psychotherapy can help with the stresses and conflicts of life that can affect anyone. For example, psychotherapy may help you resolve conflicts with your partner or someone else in your life, relieve anxiety or stress due to work or other situations, cope with major life changes, such as divorce, the death of a loved one, or the loss of a job. Learn to manage unhealthy reactions such as road rage or other aggressive behavior. Come to terms with ongoing let's see. Hold on. Come to terms with ongoing or serious health issues such as diabetes, cancer, or long-term pain. Recover from physical or witnessing violence. Cope with sexual problems, whether they're due to physical or psychological cause. Sleep better if you have trouble getting to sleep or staying asleep. In some cases, psychotherapy can be effective as medicine, such as antidepressants. But depending on your situation, talk therapy alone may not be enough to ease the symptoms of a mental health condition. You also may need medicines or other treatments. I'm so sorry, Julie, honey. Risk. Psychotherapy generally involves little risk, but because it can explore painful feelings and experiences, you may feel emotionally uncomfortable at times. A skilled therapist who can meet your needs can minimize any risk. Learning coping skills can help you manage and conquer negative feelings and fears. How you prepare. Here's how you get started. Find a qualified mental health therapist. Get a referral from a healthcare provider, health insurance plan, friend, or another trusted source. Many employers offer counseling service or referral through Employee Assistance Program, also known as EAPs. Or you can find a therapist on your own. You could start by looking for a professional association on the internet. Look for a therapist who has skills and training in the area that you need help addressing. Understanding the cost. If you have health insurance, find out what the coverage is available for psychotherapy. Some health plans cover only a certain number of psychotherapy sessions a year. Also, talk to your therapist about fees and payment options. Review your concern. Before your first appointment, think about what issues you'd like to work on. You can also sort this out with your therapist by having some sits in advance may provide a good starting point. Check qualifications. Before seeing a psychotherapist, check the person's background, education, certification, and license. Psychotherapist is a general term rather than a job title or an indication of education, training, or licensure. Trained psychotherapists may have different job titles depending on their education and role. Most have a master's or doctoral degree with training in psychological counseling. Medical doctors specializing in mental health are known as psychiatrists. They prescribe medicines and some may provide psychotherapy. Oh, was it, Digger Duck? Example of psychotherapists include psychologists, psychiatrists, licensed professional counselors, licensed social workers, licensed marriage and family therapists, psychiatric nurses, other licensed professionals with mental health training. Make sure that the therapist you choose meets the certification and licensing requirements. The key is to find a skilled therapist who can match the type and intensity of therapy with your needs. What can you expect? Hold on a second, guys. My chair keeps on pushing me away. I'm sorry, guys, if y'all are having a hard time hearing me. Your first therapy session. At the first psychotherapy session, the therapist generally gathers information about you and your needs. You may be asked to fill out forms about your physical and emotional health. It may take a few sessions for your therapist to fully understand your situation and concerns and determine the best course of action. This first session is also an opportunity for you to interview your therapist. You'll be able to see whether the therapist's approach and personality are going to work for you. Make sure you understand what type of therapy will be used, the goals of your treatment, how long each session will be. Hello, Mama Bear. Good to see you, sweetheart. I hope you're doing well. How many therapy sessions you may need. Ask questions anytime during your appointment. If you don't feel comfortable with the first therapist you see, try someone else. Having a good fit with your therapist is critical for effective treatment. You got to feel comfortable with them, guys. I'm so sorry, Julie. Starting psychotherapy. You'll likely meet your therapist weekly or every other week for 45 minutes to 1 hour. These sessions could be held in a therapist's office or you can meet during a video visit. Psychotherapy can also take place in a hospital if you've been admitted for treatment. In the hospital, psychotherapy focuses on safety and becoming more mentally and emotionally stable. Types of psychotherapy. We just covered this a few minutes ago, but I like to pull up a couple different websites to see if it's similar or the same thing or it's got more information. I just like to do that, guys. The more information on these things that we're bringing awareness to, that trolls don't realize you can bring awareness to whatever you want to, the better it will be. Some psychotherapy methods proven effective include congenital behavior therapy, which helps you identify unhealthy negative benefits and behaviors and learn healthier coping skills. Dialectical behavior is a type of CBT that teaches behavior skills to help you handle stress, manage your emotions, and improve your relationships with others. Acceptance and commitment therapy, which helps you become aware of and accept your thoughts and feelings. It also helps you commit to making changes and improves your ability to cope with and adjust to challenging situations. Psychodynamic and psychoanalyst therapies, which focuses on increasing your awareness of thoughts and behaviors that you may not be aware of. These therapies help you find out what motivates you and help you resolve conflicts. Interpersonal psychotherapy, which focuses on problems with your relationships with other people to improve how you relate to others, such as family, friends, and coworkers. Supportive psychotherapy, which improves your ability to cope with stress and difficult situations. She was asking her more questions than she was asking me. Or you was, yeah, I don't blame you, honey. I mean, if I'm going to have a therapist or a counselor, in my opinion, I want them to be comfortable. And I think, you should both equally get to know the person like they get to know you. You get to know them, Wow. That's crazy. I'm sorry, guys. It's been a long day. It says online apps are available to use several methods. Psychotherapy formats include individual, couple, family, or group sessions. These formats can be effective for all age groups. During psychotherapy, for most types of psychotherapy, your therapist encourages you to talk about your thoughts and feelings and what's troubling you. Don't worry if you find it hard to open about your feelings. Your therapist can help you gain more confidence and comfort as time goes on. Because psychotherapy sometimes involves intense emotional discussions, you may find yourself crying, becoming upset, or even having an angry outburst. I did, honey. I had to buy a battery, and Lord, it was a fortune. They took every penny we had just to buy a stinking battery. Let's see. You may also feel physically exhausted after a session. Your therapist can help you cope with these feelings and emotions. After a session, your therapist may ask you to do specific activities or practice what you learn. Over time, discussing your concerns can improve your mood and change the way you think and feel about yourself. It can improve your ability to cope with problems. Confidentiality. Except in rare cases, conversations with your therapist are confidential, but a therapist may break confidentiality if there is immediate threat to safety or when state or federal laws requires reporting concerns to authorities. Your therapist can answer questions about confidentiality. Length of psychotherapy. The number of psychotherapy sessions you need and how frequently you need to see your therapist depends on factors such as your mental health issues, severity of your symptoms, how long you've had symptoms or been dealing with your mental health issues, how quickly you make progress towards your treatment goals. I know, Julie, honey, but it just sucks because it completely flat broke us. How much stress you're experiencing, how much your mental health concerns interfere with daily life, how much support you receive from family members and others, cost and insurance limitations. The length of psychotherapy sessions can depend on methods used. For example, congenital behavior therapy consists of a shorter course of treatment, but dialectical behavior therapy can take longer. Your therapist can help you understand how long treatment will take. It may take only weeks to help you cope with short-term issue, or treatment may last a year or longer if you have long-term mental health issue or long-term concerns. Results: psychotherapy may not cure your condition or make an unpleasant situation go away, but it can give you the power to cope. I know, Miss Julie, honey, that's the truth. It sucks. Cope in a healthy way and feel better about yourself and your life. Get the most out of psychotherapy. To get the most out of psychotherapy, take these steps. Make sure you feel comfortable with your therapist, kind of like I said a few minutes ago. If you aren't comfortable, look for another therapist who can make you feel more at ease. Approach therapy as a partnership. Psychotherapy is most effective when you actively participate and share in decision making. Make sure you and your therapist agree about the major issues and how to work on them. Together, you can set goals and measure progress over time. Lord, it's so freaking hot in here, guys. I'm sorry. Be honest, or open and honest. Success depends on your willingness to share your thoughts and feelings and experiences. It also depends on whether you're willing to consider new insights, ideas, and ways of doing things. If you hesitate to talk about certain issues because of painful emotions, embarrassment, or fears about your therapist's reaction, let your therapist know. Follow your treatment plan. If you feel down or lack a motivation, it may be tempting to skip psychotherapy sessions, but doing so can slow your progress. Try to attend all sessions and think about what you want to discuss. You can always write it down, guys. We've covered, mental health a lot, and it always says, like, write it down in a journal. Write what you feel and take it with you to your therapist so they can see kind of what you go through on a daily, because they only see you once or twice a month. So that gets them to know you better, in my opinion. Don't expect instant results. Rome wasn't built in a day. I'm sure you guys have heard that before. Working on emotional issues can be painful and it may require hard work. You may need several sessions before you begin to improve. Do your homework between sessions. If your therapist asks you to document your thoughts in a journal or practice coping skills, like I just said a few minutes ago. Outside of your therapy sessions, follow through. These assignments can help you apply what you've learned in therapy sessions. If psychotherapy isn't helping, talk to your therapist. If you don't feel that you're benefiting from therapy after several sessions, talk to your therapist about it. You and your therapist may decide to make some changes or try a different approach that may be more effective. And then I have one more, guys. So we'll probably have less than an hour live. It's so freaking hot in here. Lord, I'm burning up. Try to make this one a little bit bigger, guys. Lord have mercy. Okay. It says the importance of counseling. This was dated for, oh my goodness, July the 28th, 2024. So not too long ago. It says positivepsychology.com if anybody wants to look. Meow. All right, hush. Importance of counseling. 14 proven benefits of therapy. Counseling is known as one of the greatest helping professions on earth. Yet many people remain perplexed about the true meaning, purpose, and intention. Most likely, the practice of offering counsel to others has always occurred in some fashion with humane society. We are relational beings, experience of rage or emotions, and have an innate desire to avoid suffering and live abundant lives. Today, 1 in 5 American adults have a mental health condition, and research shows that these conditions can be effectively treated. Center for Disease Control and Prevention, 2018. Not only can counseling treat mental health conditions, it can also help individuals, groups, organizations, and society optimize well-being. In this article, we further discuss the importance of counseling with a list of scientifically researched benefits. Before you continue, let's see. Hold on 1 minute. Okay, there we go. Sorry. Why is counseling important? 5 proven benefits of counseling. The truth is that our finest moments are most likely to occur when we're feeling deeply uncomfortable, unhappy, or unfulfilled. For it is only in such moments, propelled by our discomfort, that we are likely to step out of our ruts and start searching for different ways or truer answers. M. Scott Peck. Well, I swear my chair keeps on rolling backwards. Millions of people have experienced the benefits of counseling. Counseling is a specific mental health discipline that includes aspects of guidance and psychotherapy. Effort 2018. It focuses on wellness modeled aimed at improving the quality of life and involves both the counselor and the client in collaboration. Outcome research measures the effectiveness of counseling interventions in response to the therapeutic process. For 2018, using theory and empirically validated research keeps counselors in the profession accountable and ethical. While experiencing the benefits of counseling is the goal, outcome researchers allow us to find the best practices, evaluate techniques, and optimize counseling approaches for clients. Psychotherapy and other counseling techniques help individuals explore moods and behaviors, provide fresh perspectives, and offer a better understanding of emotions. Counseling can help improve mood, treat mental illness, reduce medical costs, improve communication and relationships, and promote self-esteem and resistance. Hello, Jeffrey. Good to see you. I hope you're doing well. Here's a list of benefits of counseling based on research. What's going on, Jeffrey? Prayers. Number 1, scientific evidence for treating mental illness and improving mood. Lord have mercy, it's so stinking hot in here. Make sure y'all hit the like, share, and subscribe if y'all haven't done so. Good Lord. Gotta stop every few minutes because it's so hot in here. I got sweat rolling down my eyes. It's hot. I hope y'all are staying cool where y'all are at. Oh, she's not. I'm so sorry, Jeffrey. Prayers. Counselors use a myriad of techniques and approaches to improve the mental health and well-being of clients. Gendrick and Essengard 2000 reviewed 15 outcome studies regarding the efficiency or efficacy of solution-focused brief therapy, SFBT, for depression, anxiety, parenting skills, psychological adjustment, antisocial behaviors, alcohol use, and family conflict. 5 of the studies were tightly controlled, and all of them found SFBT to be significantly better than no treatment. Depression is one of the most common mental health conditions in the world. It is a chronic condition that hinders quality of life and involves sleep problems, appetite changes, and feeling of guilt or apathy. The 3 types of depression that can be effectively treated with counseling include major depressive disorder, seasonal affective disorder, and dysthymia. I'm probably saying that wrong, but a systematic review of 30 studies examining the effectiveness of counseling therapy treatments found that psychological treatment of depression was more effective than traditional treatment, pharmacological, or no treatment at all. Oh, you must be cold, Demetrius. I'm burning up. Lord, it's hot. All studies in the meta-analysis were randomized controlled trials of depressed adults in primary care. The research found that congenital behavior therapy, or CBT, was particularly effective in both short and long-term treatment trials. Anxiety is another common mental health condition affecting approximately 19%. I have a fan, but it's just not working. It's still freaking hot. Of the U.S. population, National Institute of Health 2017. Clinical anxiety is chronic and often debilitating for people. I'm telling you, Lord have mercy. We only got in our house, some of our fans broke. So we only got, let's see, 1, 2. In our whole house, we have 4 fans at work. 4 fans in my whole house. Yeah. 3 main types of anxiety are generalized anxiety, social anxiety, phobias. Many forms of counseling have been found to treat anxiety effectively, relieve uncomfortable symptoms, and adjust maladaptive behaviors. Well, they keep it cold, honey, for germs. I heard that they keep the hospitals and doctors' offices and stuff like that cold because if it's warm, you spread germs. So I don't know if that's true or not, but that's just what I heard. While CBT consistently demonstrates the most effective results as relieving symptoms of anxiety, acceptance and commitment therapy, mindfulness and talk therapy have also been used as counseling techniques to effectively reduce anxiety. Another form of anxiety, counseling for OCD. Several theories came forward in the 1940s that explained the fear, anxiety, and avoidance of obsessive compulsive disorder, or OCD, where the fear of a stimulus is avoided to reduce anxiety, and the behavior avoidance results in repeating compulsive rituals. Once OCD was seen as an anxiety disorder, early behavior therapy such as aversion therapy and exposure therapy were developed to treat the condition. Today, there are over 40 years of research to support a consensus among researchers and counseling professionals. The CBT is an effective treatment for OCD. Exposure-based treatments have the largest pool of evidence to support efficacy. About 80% of patients respond to some form of therapy for OCD. Shoo, Lord have mercy. Counseling can reduce medical costs. There's a direct link between physical and mental health. Often when individuals treat underlying mental health conditions or receive counseling to help regulate emotions. Shoo, Lord have mercy. And improved mood, physical health improves as well. One study found that psychological treatment among individuals with chronic physical conditions in a small group settings decreased medical care costs by $10 for every dollar spent. This shows the significant physical and financial benefits counseling can offer. Counseling can provide education and treat skills. Psychoeducation is a process of explaining mental health conditions, diagnosis, services, and treatment options. Many people who come into counseling know that they are suffering but understand nothing about the underlying causes, specific conditions, or how certain techniques can address persisting problems. Psychoeducation can help normalize problems, decrease stigma, and increase compliance with treatment plans. It is a large component of many trauma treatments. Sure, my goodness gracious. Among individuals diagnosed with schizophrenia, psychoeducation was found to reduce rehospitalization rates and reduce the number of days a patient was hospitalized. Various techniques are used in counseling to teach and practice skills that provide both short and long-term relief. Clients learn general skills like self-awareness, active listening, and communication skills, as well as specific mindfulness and behavior change skills. Hello, Naughty Rules. Good to see you, sweetie. I hope you're well, honey. Thank you so much for hitting the like, darling. The baby started school today, so I'm exhausted and I'm burning up. It is so hot. As an example, CBT skills teach clients how to identify. Sorry, guys. Lord have mercy. It is so hot. To identify and reframe faulty thought patterns that lead to distressing emotions. This positive replacement thoughts worksheet is a typical example. Learning and practicing these skills in counseling sessions can change long-term patterns of negative thoughts and behaviors. Number 5, counseling can promote factors of resistance. Resistance factors include having meaning or purpose in life, experiencing positive emotions, hardiness, self-esteem, active coping, self-efficiency, optimism, congenital flexibility. While there are specific resistant training programs focused on improving these factors, many forms of counseling increase these aspects of resistance too. Through discussion, role play, practical exercises, and homework, various counseling procedures offer a basis for teaching and strengthening resistance. For example, stress inoculation therapy. I'm probably saying it wrong. Designed for anxiety has also improved measures of resistance. Stress inoculation therapy is a form of positive CBT that can teach individuals more adaptive patterns of thinking and emotional and behavior responses. Most clients come to counseling looking for help with one specific area of their life, but they can leave therapy with new insights and skills that provide meaning, positive emotions, coping skills, and a healthier sense of self-worth. Shoo, Lord, guys, I'm really burning up. Oh my goodness gracious. I'm just going to go over these pretty quick, guys, because I feel like I'm going to pass out. It's so damn hot. 3 reasons why career counseling is important. Career counseling is important for employees, employers, and organizations. According to the National Career Development Association, a career counselor is someone educated, trained, and experienced in helping employees overcome career obstacles and achieve their highest career aspirations through assessment, performance improvement, career transition, career planning, workplace, and work-life balance situation. I'm burning up, guys. I'm sitting down, but I'm really, really, really burning up. Number 1, career counselors can help employees find potential employers. I'm just going to go over these pretty quick, guys, because I'm telling you. Career counseling maximizes person, job, organization fit. Career counseling helps organizations and employers. Oh my goodness. 4 benefits of group counseling. Group counseling is a great option for therapy and can offer unique benefits that individual counseling may not be able to provide. Group counseling is just as effective as individual treatment for most conditions as long as the group is specific to the focus of treatment. And we just talked about group therapy a few minutes ago. It involves 1 or more people. Shared struggles. Group counseling provides a safe atmosphere where individuals share similar struggles and feel acceptance and understood. I'm telling you. Accountability. Regular meetings of group counseling offer an opportunity for accountability. Education and self-evaluation. Groups can teach individuals about themselves. Each member is holding up a mirror to others in the group. I'm trying to stay with it, honey. I'm just burning up. It's really hot. Tomorrow I go to the doctor. It's a checkup, I believe. Check my A1C and all that stuff where I'm a diabetic. Members of the group can learn more about a specific topic of the group and how their personal experience with it is interrupted. Additionally, groups can teach unique social skills as members practice interacting, listening, and reflecting. Cost effective because the cost of therapy is shared between members in a group setting. Their price per session is generally cheaper. Individuals may be able to receive the same mental and emotional benefits from counseling in a group and reduce the financial strain that's often associated with therapy. Oh, I can see you, Demetrius, honey. She might be busy with her uncle. And it ain't daytime, my friend. It's nighttime. Might be day in some specific, but I think Demetrius is on the same time zone as me. Counseling for students, 3 empirical benefits. Approximately 2.7 million students suffer from severe emotional or behavior problems that interfere with peer relationships and academics. Wow. Approximately 20% of school-age children have a diagnosable condition needing intervention, ranging from attention problems, depression, and unalive tendencies. School counselors are equipped to address those needs, and the benefits of counseling in educational settings go far beyond treating mental health problems. If y'all haven't hit the like, please do so. Colin and I. You're fine, Julie. I'm just giving Demetrius a hard time. Improve learning outcomes and student behaviors. Developmental guidance for social and emotional skills. Responsive services for personal situations. I love you, Miss Julie. You're a hoot, honey. Why is family and couples counseling important? Family is the first and primary place of development, learning, and attachment for individuals as they enter the world. Family therapy and couples counseling are important to help both the family unit and individual members within it. Have a good night. Have a good night, Demetrius. Family and couples counseling can help with communication problems, stressful life events such as divorce, job loss, career transition, moves, loss of a family member, mental health issues, including substance abuse, traumatic events such as hijacking, school shootings, and terrorism. Psychoeducation for parents, couples, and children's academics and behavior problems, setting goals, making future plans, and solving problems. The benefits of counseling in society at large. The impact that counselors have on individuals does not occur in a vacuum. Counseling settings include mental health agencies, hospitals, shelters, prisons, colleges. As counseling improves the mental health resistance, educational, and work outcomes of individuals, general society reaps the benefits through economic and psychological well-being and relationship improvement. Adverse child experiences as an example. One example how counseling can benefit communities at society at large is through research on adverse childhood experiences. ACEs have systematically been found to impact future physical, mental, emotional, and economic health outcomes. Oh my gosh, it's so hot. Oh my goodness, guys. I don't know if it's... Take-home message. Counselors use a variety of impractically validated techniques to improve mood, mental health, relationships, career, student behaviors, and education. Dang it. All right, guys. And that's on positivepsychology.com if y'all want to go in there and read it. I'm so sorry, guys. I'm cutting it short, but I'm absolutely burning up. So, like I said, I'm hoping you guys are staying cool. When we cover these type of lives, anyway, they're not massively long. Unless we have somebody on panel, they might be a little bit longer, but I try not to make these too long because it's just a lot of reading, but it's a lot of information. It's useful information. But I hope you guys like my background. I thought it was really cool. But I always say this before I go, and like I said, I hate to cut this short, but we just made it short live anyway. Always be kind to one another. You don't know what people are going through. You don't know what they're currently going through in their life, what they've been through in their life. Be kind to one another. Doesn't cost a penny to be kind to somebody. I know, ain't it pretty? It's pretty, ain't it? But be a difference in somebody's life. Don't be no better than nobody. But be a better person than you was yesterday. It's just hot. I think just the heat's getting to me, guys, honestly. But, there's nobody better than nobody. So just be a difference in somebody's life. Be a better person you was yesterday. People always remember what you said to them and what you done for them. So just lift each other up, be there for one another, and support one another, no matter what. Be a better person in this world that we live in and be a difference. I love you guys. I think Rebel's going live tomorrow night. I think it's like 9 o'clock. I might be wrong. And, y'all just go over there and support him. And then we will be live here on, we'll be live on White Trash Family, 2229 first. Then we'll come over here and have karaoke on Friday and Saturday between 9 and 9:30. I have it set for 9, but it could be switched to 9:30. Either way, it's not going to be no later than 9:30. So y'all have a wonderful night. Thank you guys so much for coming in here. I know these type of lives, we don't normally have a lot of people, but I do appreciate each and every one of you guys coming in here and watching and listening and being there for me. I couldn't do what I do without all you amazing people. And from my heart, and my heart is huge, the bottom of my heart, I love each and every one of you guys. I welcome y'all. And please know that you're not alone and that, I'm here for all of you guys. No questions asked, no judgment, all positivity, all good vibes, and all true. All true. And I know true people are very hard to find, but I am true as me and Rebel are true as they come. So y'all have a wonderful night. Y'all have a wonderful night, and I will see you guys very soon. And if y'all are watching a replay, please hit the like, share, subscribe, and comment. Let me know what you thought about the information we went over. And I will see you guys very soon. All righty. So I will see y'all. Have a good night. Love y'all. Peace.